Fetal alcohol syndrome is a disorder that can be characterized as growth, physical, and mental problems that may occur if the mother drinks while she is pregnant. It's the most common cause of preventable mental retardation in the U.S., and is starting to become more prevalent in mothers with low income, as they do not have the funds available to access prenatal care and education that's necessary to prevent this from occurring. The symptoms are physically or poor growth of the baby in the womb and after it is born, decreased muscle tone, possible heart defects, narrow, small eyes, small head, small upper jaw, and a smooth groove in the upper lip. Mental defects are hyperactivity, impulsivity, difficulties with planning and mental organization, visuospatial problems, lack of awareness of social cues, and difficulties understanding the consequences of their own behavior. Recently, there's been some conflict in the media regarding the amount of alcohol that could actually harm the fetus, and obviously, binge drinking has the most effect, but it's also been proven that just one drink a week can have an effect on the child later in life. In fact, it showed that children who were exposed to any amount of alcohol showed 3.2 times greater odds of displaying delinquent behavior. But timing of pregnancy is vital as well. So during the first 3 months of pregnancy, the fetus is developing its head, its arms, its legs, its brain. So it's very important during this time to refrain from alcohol, as well as the rest of the pregnancy, because either way it's going to cause damage. One factor contributing to the prevalence of this disorder is the characteristics and conditions of the mom. It's believed that the medical history of the mom plays an important role in whether she decides to consume alcohol during pregnancy or not. A study done on American Indians compared mothers of children with fetal alcohol syndrome to mothers of children who did not have it, and it showed that mothers of children who did have fetal alcohol syndrome waited until the 6th month of pregnancy to receive prenatal care, had more pregnancies, and were older. These mothers also had more mental health problems such as depression, sexual abuse, STIs, significantly higher levels of alcohol abuse, lower education levels, and lower rates of using birth control. So it's shown that alcohol abuse during pregnancy can be related to their background. And then another point that I'd like to make is that most pregnancies are unplanned or unintended. And then unintended pregnancies are associated with younger, less educated, poor, and minority women. So these women are more likely to not receive prenatal care and are likely to continue drinking throughout pregnancy. But I believe that although the mother's background plays a huge part in it, I think low income does as well. It prevents the mother from seeking prenatal health care because she can't afford it, which also contributes to a lack of education because most of the education is conducted in the provider's office. So you may ask, has anything been done in the past to try and reduce the occurrence of the disorder? And, well, sort of. Healthy People 2010 formed 5 objectives that were based on education and screening on multiple levels. But as the evidence shows, this education has not been successful enough because moms are not keeping appointments, missing out on prenatal care, and levels of fetal alcohol syndrome are staying the same. Therefore, I think there needs to be another program implemented. And it's something similar to the book that we read at the beginning of the semester, but based more around the Early Start program that the Vanderbilt School of Nursing created. Theirs centered more around teen pregnancy by removing transportation barriers, offering convenient after-school scheduling, small incentives to entice them to keep appointments, make healthy lifestyle choices, etc. So I would put this in a low-income area. Expectant mothers could call and request transportation to the nearest clinic or office. It'd be funded by Medicaid or other sponsors in case local transportation was unreliable. Members of the clinic would consist of social workers, nurses, and physicians. They'd be available for patients on call, and they'd perform all the necessary screens and ultrasounds and blood testing to see if they tested positive for alcohol. They'd also educate them on birth control, the effects of alcohol that they can have on their baby if they decide to drink while pregnant, and also just distribute information more about STDs and other things that could affect them while they're pregnant. So by implementing this program, I think expectant mothers can have access to cheaper prenatal care and education, and therefore will be more compliant with their appointments. Then once this is established, they will seek prenatal care sooner, and the prevalence of fetal alcohol syndrome will decrease.